Hello, and I'm terribly sorry not to be there in person, although no one I suspect is being there in person in our new abnormal times. And the reasons I am not there speak loudly to the issue being challenged by your new and important report. South Australia and much of the world continue to become more unequal in both health outcomes and in access to the social, economic, and environmental resources that determine health. It should be no surprise to anyone watching or listening that the new COVID-19 virus that is wreaking health and economic chaos in countries around the world will inevitably hit people and countries in the most vulnerable, most unequal conditions. In South Australia, this will include many of the groups your report itself identifies: the unemployed, the gig workers, those facing diminishing social protection measures. As in other high-income countries, our public health systems have been eroded. We have looked to markets and to private providers to offer care, transforming ever more of our humanitarian essentials into profit-making ventures. Public taxation as a percentage of economic wealth remains well below levels 40 years ago and continues to fall in many parts of the world. The over-consuming wealth of a small handful of global elites that one can almost count on one set of hands and toes is greater than that of the majority of humanity. Where Australia's bushfires of recent months are harbingers of a climate change countdown likely to hit its apocalyptic deadline within most of our lifetimes, and where huge swaths of our fellow sisters and brothers struggle in refugee camps and informal settlements, fleeing violence, famine, and a soul-crushing poverty that no amount of rejigging of the World Bank's extreme poverty lines can make arithmetically invisible or less painful. That is the millennial new world in which COVID-19 emerged, and which in 2 short months became the world's most serious pandemic since the 1918 flu. Crises, of course, can be transformative. And what are the lessons our new pandemic so far has taught us? First, that our market-driven model of globalization is highly vulnerable to shocks and can unravel with remarkable speed. Second, that our political systems remain short-sighted and too quickly forgetful of the need to plan for the health and economic volatility we have been living with since the early 2000s. Third, that without strong and well-funded public systems, financed through redistributive taxation policies and with well-regulated financial and labor markets, all but a small minority of the 1% will face increased health and social vulnerabilities as the present COVID crisis passes into a likely deep and disequalizing recession until the climate crisis resumes its existentially threatening trajectory. But as your study points out, we know what we must do. We know what policies need to be in place. We know what economic practices need to change. We know what public programs need to be strengthened and what infrastructures need to be rebuilt. Your report focuses on a small slice of human geography and population, colonization, and settler history that we call South Australia. But its recommendations are nothing less than a starting blueprint for a new social order. The COVID crisis presents all of us with the opportunity, indeed the absolute necessity, to promote that new social order to the loudest and greatest extent possible. A century ago, writing around the time of that earlier global pandemic, the Italian philosopher Antonio Gramsci wrote of how an old world is dying and the new world struggles to be born. Your report roadmaps that new world and makes a small but vital contribution to its struggle to be born. Do not let your governments forget its important messages once the current COVID crisis subsides. Thank you for allowing me to speak to the release of this wonderful new report.